Well, welcome everyone to this fascinating seminar, The Social Context of Drinking Among LGBT plus people and communities. My name's Ian Gilmore and I chair the UK Alcohol Health Alliance. We've got two very good speakers for you. I think you've been sent the housekeeping instructions about the questions, but basically I think you put them into the chat either in general or directed specifically to Meg Griffiths if you want to keep them confidential. I'll bring some of you in to ask your own question. If time doesn't allow, I might ask one or two of them on your behalf. So two excellent speakers. The first is Professor Carol Emslie, who's the lead in the Substance Use Research Group at Glasgow Caledonian University, and her research is focused on gender and alcohol use. She co-chairs the Scottish Alcohol Research Network, facilitates the SSA Qualitative Methods Journal Club, and is also an editor for the journal Addiction. She's going to be followed by David Barbour, who is an alcohol brief intervention practitioner for the Glasgow Council on Alcohol, and was also involved in the founding of the Glasgow LGBTQ+ substance use partnership about 2 or 3 years ago. This is to address the disproportionate impact of substance use on people of these communities. So without more ado, because I don't want to take up their time, I'd like to hand you over to Carol.
Thanks, Ian, and good afternoon to everybody. I'm delighted to have this opportunity to talk about our work on LGBTQ+ people and alcohol, and I'm really pleased to be joined today by my colleague David Barbour from the Glasgow Council on Alcohol. So what we're going to talk about today? Well, firstly, I'm going to tell you a bit about our findings from a research study about LGBTQ+ people and alcohol. But I think because all of us here are interested in getting research into action and actually making a difference in the world, David's then going to tell you about the work of the LGBTQI+ substance use partnership. So really trying to get research into action. So why focus on this group of people, this population? Well, we know that LGBTQ+ people, and when I'm using that term, I'm meaning people who identify as lesbian or gay or bisexual, trans, queer, non-binary, or otherwise gender or sexually diverse, are more likely to drink alcohol, are more likely to drink excessively, and to experience alcohol-related problems than those who identify as heterosexual or cisgender. And finally, last year in 2021, we had the first report which actually gave us some national representative data on the health of lesbian, gay and bisexual adults in England. And from this report, we know that around a third, 32% of lesbian, gay and bisexual adults report drinking over the 14 units of alcohol. That is the low level limit at the moment. So a third of lesbian, gay and bisexual adults report over 14 units compared to 24% of heterosexual adults. We also know from international literature that the risk for past year alcohol dependence among lesbian, gay and bisexual people is at least 1.5 times greater than for heterosexual people. And we also know from Canadian data that heavy episodic drinking, sometimes called binge drinking, is 1.5 times higher among trans adults compared to the general population. And just to add a bit of additional context, of course, we know that health inequalities have been exacerbated by COVID, and so that also applies to the LGBTQ+ community. So what are the gaps in our knowledge? Well, there's historically been fairly little research on LGBTQ+ people and alcohol. What does exist tends to focus on gay men or men who have sex with men. And for example, our recent systematic review of alcohol interventions focused on LGBTQ+ people only found 25 studies, and of these 20 focused exclusively on men who have sex with men. We know particularly from US literature that there are quite large differences between sexual minority women, so those who identify as lesbian or bisexual, and heterosexual women, but we don't know an awful lot more about these differences apart from the fact they exist. And there's very little known about trans people's drinking. So a few years ago, we were fortunate to be funded to conduct some qualitative research to really try and understand the meaning of drinking in day-to-day life for LGBTQ+ people. Some of the explanations that have been offered for these high rates of drinking and harmful drinking focus on LGBTQ+ people coping with discrimination, marginalisation and stigma, and also the possible additional barriers that LGBTQ+ people have seeking support from health professionals and alcohol services. But one thing we wanted to do was take a wider approach and look at the broader context. So here we have a quote from Tyler Curry in the US, and he says, "The modern day LGBT rights movement was practically born in a bar when the people at the Stonewall Inn finally decided that enough was enough. Even now, gay bars are where many young men and women first learn to become comfortable with their true identity." And of course, he's referring back to the Stonewall protests that started after a police raid in a gay bar in Greenwich Village in New York City. But I think it's a really interesting point that's being made here about clubs and pubs being seen as safe spaces for LGBT+ people to express themselves. So for our study, we conducted and facilitated 7 focus groups. And what we wanted to do was talk to pre-existing groups, so friendship groups or people who knew each other as colleagues, to tap into some of these conversations, to tap into these wider social contexts that LGBT people were having in the conversations and their experiences around alcohol. We recruited focus groups from sports groups, from bars, from LGBT groups, and from workplaces. We had 14 people who identified as gay men, 11 as lesbians, 4 as bisexual, and 4 as straight or other. And of the sample, 29 were cisgender, so in other words, their gender assigned at birth, body, and identity are consistent, as opposed to 4 people who identified as trans. We're very fortunate to be funded by Scottish Health Action and Alcohol Problems. And through their help, we were able to launch a report in the Scottish Parliament, release our findings to the press, and work with policymakers and third sector partners. So our sample were aged 18 to 53 years, half were educated to degree level, and one limitation was that our sample were almost all part of the majority white population. We were very keen in this study to talk to people who saw themselves as normal drinkers, not those who self-defined as heavy drinkers. And 27 people out of the 33 in the study reported drinking within the recommended weekly limits at the time. So we collected qualitative data from our focus groups and analysed this using thematic analysis. So I'm going to take you through kind of 3 of the main themes from the study. First of all, the experience of drinking on the commercial gay scene. Secondly, thoughts about alcohol and identity. And thirdly, perceptions of alcohol services. And if you're interested in following this up, the slides are going to be distributed, and there's links to our report and one of the papers that came out of the study on the slides. So first of all, drinking on the commercial gay scene. Almost all of our respondents had experience of the gay scene. Obviously, they socialised in a range of contexts, but the commercial gay scene was important. They made reference to Glasgow's drinking and dancing culture, and they saw the commercial gay scene as being aimed at youth, largely being aimed at gay men. Some respondents found it misogynistic and referred to the double discrimination for bisexual and trans people, where they experienced discrimination from wider society, but also from within the LGBTQ+ community. But you go to the gay scene for the gayness. It's where you go to meet folk. So kind of central purpose here. Respondents also talked about the centrality of alcohol on the scene, and there was a consensus about the heavy drinking culture. Respondents talked about drinking to get up the courage to come out and to venture onto the gay scene. Respondents talked about strong peer pressure across the life course and felt that there were probably heavier drinkers than the general population. And they attributed this partly to the lack of places to socialise and to meet other LGBTQ plus people apart from in bars and clubs. They also talked about being less likely to have children, which they saw in their straight friends as limiting drinking in some circumstances. And also they talked about being part of marginalised groups and how this could possibly lead to isolation and an increase in drinking. Our respondents also talked about the alcohol marketing that they experienced on the commercial gay scene. These promotions usually focused on spirits, shots, or alcopops. They talked about trays of shots being brought round for customers to sample, and they thought this was more prevalent on the commercial gay scene than other bars that they frequented. And one respondent talked about guys walking about with trays half naked with shots just in their wee kind of panties to get you drunker. This kind of part reference to kind of sexualization of the people who were trying to sell you or to promote shots in these bars. And here we've got Charlie, whose quotation was used in the title of our presentation. He says, for people first coming out, the first experience of meeting other LGBT people is often on the commercial gay scene. The product that environment sells is alcohol. That idea of the pink pound and thinking who's actively trying to court you as a community doesn't seem quite so long ago when to be LGBT still seemed like something that was quite toxic and it would hurt you. And maybe being naive and just accepting their line. It wouldn't necessarily make me buy their product, but I appreciate the fact that they're advertising. So this kind of ambivalence here, where there's a recognition that the product that's on offer is alcohol, but at the same time, there's some recognition of perhaps of some progress where being LGBT when the past was seen as toxic and now they're being seen as a community to be marketed towards. And of course, what and how we drink is related to our identity, and advertisers make use of this. So here's an example of a way of selling alcohol to men, so using masculinity to sell alcohol. This example comes from advertising agency pitched to Smirnov Black. Guys are inherently lazy. Guys want easy slices of masculinity. Guys want badges of masculinity that can be worn without the effort of earning them. But of course, advertisers are also targeting women, and they're also targeting the LGBTQ plus market. We've got some examples here of vodka brands. First of all, Smirnov for their We're Open campaign. You can see the picture here. Homosexual, heterosexual, who gives a sexual, we're open. And quote, the Smirnov brand aims to empower a more inclusive world via cultural actions. And then the other image here of Absolute, who have a long history of sponsoring Pride. Okay, so continuing this theme really about alcohol and identity, which I've already kind of referred to around brands and advertising. So of course, the choice of glass or drinking vessel and the drink that one chooses is part of showing who you are to potential and current friends and partners. And our respondents were aware that stereotypes of about gay and lesbian drinking persisted. So the stereotype about gay men drinking sweet, colourful cocktails, alcopops or spirits, as compared to lesbians drinking pints of beer, real ale or Guinness. So for example, Simon says, I think there's a stereotype and it works both ways. I've been in gay bars and had a pint of real ale or something, and people have looked at me and said, what's that you're drinking? So while respondents might not agree with these stereotypes, they did agree that they still had power. And in some cases, they talked about adhering to stereotypes to try and fit in. a different example here about appearance and drink from Jackie. So she says, all my pals from school are straight. I don't drink as much when I go out with them because I'm not going to sit with a pint and a dress and heels and stuff. So I'm sitting with a vodka. And some of the respondents talked about, were they having a gay night out? Were they having a straight night out? So Jackie's here talking about having a straight night out with her straight friends from school and about matching what she's wearing to the context she's in, but also matching her drink. So given that she's with her straight friends, they're all wearing dresses and heels, she's going to drink vodka, as opposed to her usual more casual clothes. So when she was out with her gay and lesbian friends, she would drink something very different. Another example here of using drinks to signal something. And Pippa here is talking about drinking pints to signal I'm one of you when she's out on the scene. So she says, if I had any intention of going out in the pool on the scene, so looking for a partner, I would drink pints simply because no one looks at me and immediately recognises she looks like a dyke. I'm the imposter on the gay scene. Everyone just looks at me and makes the assumption that I'm straight because I've got long hair. So drinking pints, it's like my ticket to ride. Look, ladies, I've got a pint, I'm one of you. Whereas if I was sitting with the blue wicked, I'm pretty sure everyone would just be like, straight chick in the corner, we'll just ignore her. And finally, this awareness of drinking and identity was particularly acute among some trans or non-binary respondents. And it's perhaps not surprising that they were particularly aware of how their choice of drink and appearance might be interpreted by others. So Naomi says, if I'm all in drag, I like to drink like the manliest drink that I can find. My drag is kind of subversive with beard and a monobrow. I tend to then on purpose play around with these stereotypes. I'll make a point of drinking a pint because it's part of my performance. So bringing in this performance of gender around appearance, around clothes, and using a drink as a tool to express identity. And I think this is particularly interesting because it makes explicit in Naomi's narrative what we often find in other studies of men and women's drinking, where they are expressing their gender identity, but it's much more implicit. And just a couple more examples of advertising here. I like my vodka straight, but my friends can go either way. Another vodka brand, and an image from Bud Light. Okay, so perception of services now is the final theme I'm just going to talk about. So LGBT people were perceived to be invisible to service providers. They felt there was an assumption that people were straight and cisgender. Many services were perceived to be macho and intimidating for heterosexual women as well as for LGBTQ+ people. And for some respondents, self-help groups such as AA were not perceived as safe spaces for LGBTQ+ people because of the religious dimension and also because of the perception that they were aimed at white straight men. So Craig, for example, says, I know LGBT+ people that have been sent to addiction services and have not went because they know it's an intimidating environment and they feel they're going to be either judged or beat up. It's a shame. And Irene says, let's be honest, there will be people in the LGBT community that are alcohol dependent, but they probably feel they can't go to a mainstream support service because it is all about talking about your personal life. And a lot of people wouldn't come out as gay or LGBT because it's not a nice environment. So the conclusions around our research. Respondents discussed the centrality of alcohol on the commercial gay scene. And of course, remember that our research was set in Scotland, so they saw the heavy drinking commercial gay scene set within the wider context of the heavy drinking culture of Scotland. Secondly, as the alcohol industry is well aware, drinking alcohol is an important part of identity. And we also found that there was perceived to be a range of barriers for LGBT+ people when talking to health professionals and accessing alcohol services. So just thinking about what next, our research really highlighted the lack of and the need for alcohol-free spaces in the LGBTQ+ community. And we're currently advertising a PhD to specifically look at this topic, a fully funded PhD. So we hope to be reporting some exciting findings around that in the future. Our research obviously points to better diversity training for health professionals. We've also got some new research on LGBTQ+ people's experience of alcohol services. So people who've actually self-identified as having problems with alcohol and have used alcohol services. And in this research, we've also got the views of the service providers. So we've got those different sides of the different experiences to draw upon. And that research, also funded by SHAP, Scottish Health Action on Alcohol Problems, will be launched in March this year. And also what was highlighted in our research was a need to signpost information, reliable, helpful information to the LGBTQ+ community. And so I'm delighted to hand over to my colleague David Barbour now, who's going to kind of talk about the ways that some of his work has signposted information to the community. Thanks, David.
Thanks very much, Carol. I'm just going to share my own PowerPoint with everyone. Okay, so I'm David from the Glasgow Council on Alcohol, and we are one of the founding members of the Glasgow LGBTQI Substance Use Partnership, which Caledonian University and Carol are also members of. Along with, I see numerous people on this call, so that's really nice to see more members here. So what our partnership is a kind of informal partnership that basically picked up really from where Carol and others left off with research, as well as some personal experience of some of our members, including myself. So I'm a gay man who's a recovering alcoholic, who started working at GCA and felt we should be looking at this issue, and the research certainly backs that up. So yeah, that's what we've been doing, and we obviously looked at the research that Carol at Glasgow Caledonian University SHAP had done, along with some research that the Transgender Alliance had done in Ayrshire. So we found that heavy drinking culture, strong peer pressure across the life course, heavier drinkers than the rest of the population, lots of the gay scene based around the LGBT community. Lots of bars and clubs in the LGBTQ+ community as being the main sort of spaces. The other conclusions that Carol had come to around kids, marginalised groups, etc., and the sort of minority stresses that affect our community. And conclusions around the service inclusivity that we considered from Carol's research and other places around services not being acceptable or inclusive of LGBTQI groups. So really we wanted to address both of these strands of issues. So our partnership started out with Glasgow Council on Alcohol and the Scottish Drugs Forum. So it was a colleague of mine at the Scottish Drugs Forum that I used to work with, Adrian Hanna, who I think is here today. We began work on a training course from that. Scottish families affected by alcohol and drugs had attended one of our pilot courses on LGBTQI substance use. And that was the sort of germination of the partnership, which now involves many alcohol and drug services in the third sector, as well as LGBTQI services in the third sector, obviously academic bodies and employability services as well. So the structure we kind of have is that there's an overarching steering group that is chaired on a rotational basis. We then have a couple of subgroups, which are the community engagement and service inclusivity subgroups. So the community engagement subgroup looking to address, obviously, reducing alcohol and drug harm in the LGBT community through direct interventions, which might be online or might be in person, as well as a service inclusivity subgroup looking at addressing some of the problems that were identified with alcohol and drug services, particularly in terms of being acceptable and inclusive to LGBTQI people, but also looking at LGBTQI services and whether or not they had referral pathways in place or were doing anything on alcohol and drugs. Typically, you find that LGBTQI services are doing a lot on mental health, a lot on sexual health, but what we found was that maybe they hadn't looked at the alcohol and drugs or substance use issue quite as much. So it was bringing all these services together to start talking to each other for a start, which historically maybe hadn't even really been happening too much, and start to create referral pathways between each other, as well as looking to proactively make changes to our services and work together to do some community engagement work. And from that as well, we have some communications work that goes on too. So the aim of the community engagement subgroup really is to proactively engage with LGBTQI plus community around substance use, health inequalities that we face, and reduce harm. So we do that by involving the LGBTQI community in service and resource design, social diffusion of health messaging, and ideally we will look to be facilitating support groups as well. Proactively engaging with the community on substance use in LGBTQI spaces, whether those be physical spaces or online spaces. So obviously the pandemic over the last 2 years has meant there's not been very many opportunities to engage in physical spaces. We've done what we can, but that will be hopefully in the future something we'll look to do a lot more of. Certainly there's a big need, and we haven't begun to address it yet in terms of LGBTQI specific support groups around alcohol and drugs, and that keeps coming back to us in the community discussion events we've done, so more to be done there. We've done an awful lot in terms of online presence, social media, and websites, so we'll look to continue that as well. We try where possible to use a peer-to-peer engagement model. Our project last year, the Community Champions Project, which was funded by the Ripple Community Activity Fund, which was part of the Alcohol and Drug Partnership in Glasgow, has now meant that we have a Community Champions volunteer group. So that's now 11 community champions. So it's members of the LGBTQI community in Glasgow who are active and looking to be involved in interventions, but also improving services. So we have that group now that we can utilise for all the different strands of work that we want to do. And they've been trained up in substance use issues, they've been trained up in LGBTQ health issues and interventions, so that they've already been doing a lot of work, and we hope that we'll do a lot more work as a partnership with that group in the future. In terms of community engagement work, we've had 2 funded projects over the past 2 years. So the first one was the Kinder, Stronger, Better project in 2020, also funded by the Ripple Community Activity Fund. I'm not going to obviously read all of this out. A lot of stuff happened, but the main bits where we recruited some LGBTQI volunteers who we worked with them, co-produced a website and some social media videos with harm reduction messages. They came up with the Kinder, Stronger, Better campaign name, which then became the website name for the partnership. We ran a community discussion event. It was very well covered in the media and on sort of radio as well. Huge social media engagement, lots of websites, produced some videos as well. And we have to thank Media Co-op as well, who were fantastic in facilitating the co-production of the videos and the website in particular. So a really successful first step in the community engagement work. On to 2021 was the Community Champions Project. So again, as I say, recruited some more LGBTQI volunteers who now form a Community Champions group. They were trained up and worked together also to stage a community discussion event, which was attended also by Matthew Todd, the author of Straight Jacket, who gave a half-hour talk there on his book on sort of minority stress for the LGBT community and shame and what role that plays in substance use health inequalities. So again, a lot of work delivered there, and we came up with some animations that the volunteers created as well. So really good to have had that done. Lots of content came out of that project, as well as obviously the kind of sustainable volunteer group to work with in the future. In terms of the service inclusivity work that's been done so far, so the aim of the subgroup is to hopefully work towards more inclusive and acceptable alcohol and drug services for LGBTQI people, and ensure that those services have an understanding of our life experiences, the health inequalities we face, but also, as I said earlier, the LGBTQI services provide information and signpost to substance use services as well. So we're doing that via developing a training pack on LGBTQI substance use health inequalities, which is ongoing, and delivering that to alcohol and drug services particularly. Providing a kind of network and knowledge exchange and building referral pathways between services, involving LGBTQI people in the design of services and resources. So the LGBTQI community champions were involved in the publication of the sort of top tips for service inclusivity that we published in 2021. And they've obviously been involved in co-producing social media resources, harm reduction messages and videos as well. And we're looking to ensure as well that physical spaces are visibly welcoming to the LGBTQI community, and the online content takes cognizance of their experiences. So two of the main things, as I say, that we've done, 2021, we published the Inclusive Services Guide. So it provides a kind of top tips for alcohol and drug services, more so on how to be more inclusive. But we also link to other useful guides and programs. So, for example, we link to Transgender Alliance guidance on equalities monitoring, and we link to the LGBT Youth Scotland LGBT Charter, which some of our partner organisations, substance use partner organisations, are either considering or in the process now of going through. So Glasgow Council on Alcohol, for example, is now committed to undertaking the LGBT Youth Scotland LGBT Charter and doing a full revamp. So that's in addition to the LGBT substance use training that we are developing together. We find it useful probably for organisations to engage in these more detailed kind of programs. The other thing we're looking to develop with other partners is the LGBTQI substance use training, which is in development at the moment, and we're looking to also produce an e-learning course with that. So we're hoping that will get the go-ahead and funding, etc. this year. Quick synopsis of the work we've done over 2021. So this is a kind of graphic that you can look at your leisure, but just to give you an idea of some of the work we've done in picture form. We also started last year a quarterly newsletter that's aimed at both professionals and LGBTQI community members on substance use. So really trying to kind of keep it in the headlines or keep it at the top of the agenda, not just for professionals and services, but also LGBTQI people, and make sure that they are thinking about substance use and that our community is thinking about substance use regularly. What's next this year then? So what we're looking to do is exploring opportunities to potentially formalise the partnership, possibly as a Scottish charitable incorporated organisation, and have funded permanent posts, because there's a lot of work to be done. And at the moment, we're kind of relying on services donating staff time, including my own, to this. It's not any of our day jobs, although it is relevant. Obviously, it touches on all of the work we do. But we really kind of, I think, to make the strides we want to, particularly in community engagement, it would be good to have funded posts. So that's what's up next, I think. Really renewing the focus on community engagement and harm reduction, because the pandemic has limited opportunities for that. So we really want to try and get out into the community and do some interventions on substance use. We also want to really look at starting up some support groups. At the moment in Glasgow, we only have, I think, 2 AA groups that are LGBTQI specifically inclusive. So not well served as a community for that. And furthermore, we want to complete the LGBTQI substance use training pack and e-learning course and begin to deliver that to services. So that's what we're looking for in 2022. I would encourage anyone who doesn't already, please visit the Kinder, Stronger, Better website. There are a huge range of resources on there, including a research index with research from across the globe on this issue. There's social media accounts. Please follow us on Twitter and Facebook and Instagram. And please also sign up for our quarterly newsletter, which you can do at the link provided. So thanks very much.
Thank you very much, David and Carol, two excellent presentations. And it strikes me that Scotland is leading the way, as is often the case with alcohol and harm. Maybe I could just, while we're gathering questions together, ask Carol, do we know whether this is being taken seriously in other parts of the UK?
Outside of Scotland, you mean?
Yes, the rest of the UK.
Yeah. I think it's really encouraging that we finally got some data from representative samples such as Health Service and the health study for England that actually links together sexuality and gender identity and alcohol. I think that's a step forward. We've got a new alcohol prevention strategy that we hope will go out to consultation this year. And that's something that we've been trying hard with SHAP to influence in terms of taking into account the needs of LGBTQI people. I guess we'll have to wait and see if that is the case, but that's UK based. So yeah, I hope that things are going in the right direction.
Okay, I'll start the first question in, anonymous one. How can service providers ensure their recovery programs are inclusive of the LGBT plus community? I guess, David, this is very much one for you. That how are you managing to make sure that they are inclusive and people from these groups feel comfortable coming forward?
I'll give a brief answer. What the best thing to do would be to visit our website and read the guide we have produced, which has a very detailed list of things that tips that services can introduce. Some of them are really straightforward and simple in terms of physical presentation of office spaces, making them like displaying clear signs that you're an inclusive service through rainbow flags, trans flags, posters in waiting areas, different things like that. Online spaces, make sure your websites or social media accounts, either permanently or at least on Pride months, awareness days, etc., display LGBT content. But obviously that's window dressing up to a point, but also that you have some permanent stuff and that your staff are trained in these issues, your staff have an understanding of LGBTQI experiences is really important. So at GCA, we've certainly been doing that and making sure that our staff have at least some awareness of this as an issue. So,
thank you. Certainly, I remember when HIV reared its head in the 80s. Quite a lot of people from particularly the MSM community came forward as nurses, assistants and so on to help run the services for people with HIV. And I guess this may well be the same here.
I would maybe add, Ian, just briefly as well, that obviously we've tried to do it with the Community Champions Group, is to involve the LGBTQI community in design and services, especially if you aren't lucky enough to have some LGBTQI staff. GCA are, and we have made an effort in the partnership, even where it's alcohol and drug services. We know each other, obviously, maybe either personally or from previous jobs. So even a lot of the staff members from the different organisations are LGBTQI themselves, including myself and a few others that are on this event today. So
Sure.
that really helps as well.
Yeah, absolutely. There's another anonymous question here, and probably for Carol in the first instance. And from your research and experience, have you had any indication that the bar, clubs, alcohol culture has become less important with the appearance of apps that have become more popular to help people from these communities meet each other without necessarily going to a bar?
That's a really interesting question. It wasn't something that we asked about specifically in our research. David, I don't know if you've got any thoughts on that.
It would really be anecdotal or personal experience. I would, for what it's worth, I think a lot of people meet on apps now more often, but I suppose a lot of them meet on apps via the bars. I think the bars still play a huge role, but increasingly there are now other alcohol-free spaces opening up in Glasgow. So, for example, Pink Peacock in the south side is an alcohol-free queer space cafe, and Q-Toe is another potential one that's opening soon. And LGBT Health and LGBT Youth Scotland run different groups that are alcohol-free spaces specifically. But I would say for gay men, this is my feeling, the scene and the bars are still the number one place where people meet each other and socialise. So,
okay. Someone is really looking for solutions because of this intertwining of the drinking culture and the LGBT plus communities. How can we start a cultural shift away from this? Both of you, answers on a postcard, please.
How can we start a shift away from the
culture of alcohol and these communities being intertwined?
I think it's very difficult. I think it's also important, as I indicated in the presentation, not to ignore the wider context. So in the UK, we've got an alcohol-saturated environment already. So we've got that plus the intensification in some communities, such as LGBTQ+. So I don't think we just need to focus on this community. But obviously, even though, as David said, we have got some alcohol-free spaces emerging, I think for this community, if you want to go out and socialise, there's just many fewer spaces that you can do that in at the moment compared to the general population, where there would be many more places that you could socialise. So it's we're thinking about this in wider society anyway, thinking about alcohol-free spaces, but it's maybe an even more important focus for this community.
Okay. Is there any evidence that there is more alcohol-related harm, dependence, cirrhosis of the liver, or whatever? And if so, which of the communities, which of the groups would that apply to?
It's very hard to get information that drills down and separates out the groups in LGBTQ plus research. And I think, I should have said at the beginning, it's not a homogenous group. Different people, different groups within it have different needs. But the systematic review from a few years ago showed that people who were lesbian, gay, or bisexual, their risk of alcohol dependence was at least 1.5 times greater than for heterosexual people. So that ignored trans people, didn't ask about gender identity, but it seems to be, we know at least for lesbian, gay, and bisexual people. And some new research that's coming from trans adults does seem to point in the same direction. So yeah, I think the research is building to show that this is an even bigger problem in this community.
Ian, I'll just come in briefly there.
Yes, please.
As well. So I've just posted a link to the research index on our website, it really not really surprising at all to see when I was collecting this together and when Adrian and I in particular were working on the training pack for this, that basically any health inequality you would expect to see in a community that suffered more stress and trauma, we have worse outcomes, and so more alcohol harm, more drug harm, more likely to smoke, higher rates of some autoimmune diseases, all that kind of stuff that coming through quite strongly in research.
Good, thank you. Miriam Hilliard, you've asked a question. Do you want to put it directly to the speakers?
I suppose I'm just sort of wondering that when people already come from quite a sort of stigmatized and marginalized community, I'm just wondering how we can kind of focus attention on the problem of alcohol and drug use by this particular community without kind of increasing feelings of shame or self-stigma, given that people might already be feeling those kind of things.
I think it's a really important question, Miriam. It's something that I've thought about in the past with my work on gender and alcohol. When we look at women's drinking, women are more stigmatized for their drinking than men. So once you start to talk about women's drinking, you have to try and not make it into an even bigger problem than perhaps it is. I think for LGBTQ plus people, that's important as well. And when we first started doing the research, I think from some quarters, from some LGBT plus groups, there was maybe a bit of resistance about exactly what you're saying. You know, let's not throw alcohol into the equation already. But given the problems that are there, I don't think that we can ignore it. And I think the way forward is to, as David's been talking about, make sure that services are properly trained so that they take into account people's sexual orientation and gender identity, if that's important. So we're not saying that every LGBT plus person is going to have alcohol problems, and even LGBTQ plus people who go to services, it's not always going to be interwoven with their identity, but for some people it will be. So I guess it's that patient-centered approach where you find out which elements of identity are salient for which people coming to see you.
Yes, and Anna Livingston had a related question that would fit in well here. Anna, are you able to make your point?
Sorry, I had unmuting difficulty. No, it's just a small, well, it's a small point in a way, but where I'm sitting in Tower Hamlets is perhaps a big point, and I know Glasgow has quite a multi-ethnic community. So really it was what sort of issues, and are there specific services and issues that have arisen in relation to people from different religious, cultural, ethnic backgrounds here?
I think that intersectionality is really key, and that's something we didn't really manage to achieve with this piece of research. It was very much, the people we managed to recruit were very much from the majority white ethnic population. But whenever we do research, I absolutely agree, we need to think about culture, we need to think about religion, we need to think about the other roles that people have and socioeconomic status. So it's not just one identity that we're looking at. David, I don't know if you want to add anything?
I would probably just echo that and say that, yeah, because when you break it down also into likes of disability, when you're thinking about intersectionality as well, there's you kind of add all these other elements to it that are important in their own right. I think, yeah, what the partnership is focusing on is that, first of all, we need to, just to also sort of answer Miriam's question, it's really tough because I think there's an element of denial amongst some of the LGBTQI community that we have a problem with alcohol and drugs as a community. Like, if we want to be united as a community to tackle this, we need to accept that we have a bit of an issue. It's not our fault, and that's the key thing, is to always get over. So in terms of the self-stigmatization, it's not because we're gay or bi or lesbian or trans that we drink more or we're more hedonistic and all that nonsense. We have that response. We self-medicate for stress because we have been caused stress by the rest of society. It's not our fault that we have this issue, but we do have it, and and by working together and being kind, which was kind of the thrust of our campaign, by being kind to each other and by working together, coming together as a community, like we have with every other previous health issue we've faced, it's the only way we've ever made progress is us doing it for ourselves, and coming together to make changes. So that's how we'll do it, and educating everyone that, you know, what we really need here, as with many issues, is for homophobia and transphobia to stop, and not to go backwards on that, which sadly has been happening in the last year or two. The UK was just named alongside, I think, Russia, Turkey, Hungary, and Poland as being a hostile environment for LGBTQI people in the last couple of years. That's not going to help achieve the aims we want to achieve.
No. Well, thank you very much. Now, there's a question from Maruksa. Would you like to unmute and give it, Maruksa?
Yeah, hi, Mariska Greenwood from LGBT Health and Wellbeing, and we're one of the partners who's been involved in this work, which has been really great and long overdue for sure. I just wondered, and maybe this takes us a little bit off topic, but what we know about the impact of the pandemic on levels of drinking within the community, and given that this has been a period when that link with the gay commercial scene has somewhat been broken. But also a time when our community has been under immeasurable stress, and we know the pandemic hasn't affected everyone equally. It's kind of acted to exacerbate inequalities. What we know about what the impact of the last couple of years has been on levels of alcohol consumption in the community.
Hi, Mariska. It's really nice to hear from you. Mariska was at the launch of our research and was one of the partners that spoke for this study. So it's very nice to hear from you. I think it's a really important point, and some of our work going on at the moment has found the stresses that LGBT plus people were facing during the pandemic, particularly when they perhaps young people were returning to the parental home, which wasn't perhaps as supportive as other environments they were in with their family of origin rather than their chosen family. We know that in the general population, people who drink heavily already were much more likely to drink even more heavily in the pandemic. And I think that's what we're going to find when we find out more from studies in the future. We have some indications from the Pink Saltire study research in Scotland, which found that more than 1/5 of LGBTQ plus respondents reported drinking more during lockdown, while over 1/3 reported using other substances. So I definitely think that the inequalities that we see generally are going to play out in the LGBTQ plus community, unfortunately. David, I don't know if you had any insights from online alcohol brief interventions or helplines or anything?
I think all I was going to do there was probably quote the Pink Saltire research as well, and maybe one or two other things I've seen that sort of echo that. Yeah, like you said, Mariska, that LGBTQI people have been probably more affected by the pandemic, like other minority groups. So I think the answer is I don't know, but I would just expect that, given that we saw alcohol deaths increase by 17%, was it the highest rate in about 11 or 12 years or more in 2020. I would imagine that probably then superimpose that kind of onto our community, and that maybe it's been a bit worse. I couldn't know. I know that obviously as well there's been issues around isolation raised because of the bars and other spaces being closed, and maybe being more affected by that. And if our mental health has been more affected, it stands to reason that substance use might have been more affected. I think, even if we haven't got research to back it up, I would say it's a reasonable assumption. So, yeah.
As Carol said, we know that the heavier drinkers who put their foot on the accelerator during lockdown, and so it would be surprising in a sense if these communities were not affected even a bit more than most. Here's a difficult question. Has there been any recognition from the alcohol industry on this specific marketing angle and the harm it leads to?
To imagine the alcohol industry are probably quite pleased that they're saturating another market. So I think that would be the line of many rather than.
I'm sure they'd be privately rubbing their hands with glee, but I wonder whether they've been approached and whether they have made the usual sort of attempts that they're going to change or support, or throw 0.001% of their profits into some little project to ease their consciences.
I know that particularly in the States, some of the vodka brands have put some money into LGBT organizations, but of course, health researchers and LGBT organizations themselves are saying, we're stopping with the devil here. Is this something we really should be doing?
Too right.
And I can answer and say that there's one LGBTQI service in Scotland that has certainly had funding from I think the Scottish Whisky Action Fund to do a project, which I think caused a little bit of consternation, but it was a kind of research project, but possibly was useful. But I think the partnership kind of agreed we weren't really in favour of taking money from the alcohol industry.
No, absolutely not. No.
And yeah, so it's a difficult one. Another just very quick point on this, because I think when people talk about the drinks industry, they think of the companies who manufacture beers, wines, spirits, blah, blah, blah. I think another area of work we want to look at is the gay bars themselves, and what are they doing, and are they providing harm reduction information around substance use, and or are they promoting heavy drinking, or are they providing a space that's a neutral space without any promote? I would argue that there are some spaces that are celebrating problematic alcohol use, and given the sort of shots deals, pound shots, and the rest of it, as all bars do. And that this is another area we need to look to sort of maybe get the gay bars, not just in Glasgow, I mean all over the UK, and elsewhere. They've historically been fantastic, the gay bars, at working with organisations on sexual health, and they have allowed people to organisations to go in and do assertive outreach around sexual health and obviously HIV. So I think that's another step that we need to look at taking.
I think if you haven't done so, it'd be well worth, Carol, speaking to Mark Pettigrew, who's done so much work on the dark side of the industry, particularly the advertising. They were certainly very early on to women's drinking, as you well know, and I'm sure he would be interested to have a look sometime at the undercurrent of marketing directed towards these particular groups.
Yes, Mark's work's excellent. I also know that Amanda Atkinson and colleagues in Liverpool are talking specifically to LGBT people about drinking and looking at bars there. So I think that will be very interesting research when that comes out.
There's an alcohol-free bar in Liverpool, as there are in a few major cities now. Any way that they can be harnessed to help?
Yeah, I think David mentioned a couple of examples. There's one existing in Glasgow and there's another one trying to get off the ground. So I think that would be fascinating. I also really enjoyed Emily Nichols' talk from the Institute on Alcohol Studies on no and low alcohol. And I wonder about whether gay bars are selling these drinks and whether there could be some substitution from alcohol to no and low alcohol. Of course, we know there's dangers around that as well, but I think there's lots of interesting approaches that could be tried.
Absolutely. Well, the clock has caught up with us. It's 1 minute to 3, so just really enough time to thank you both for fascinating talks, for highlighting a really important area, and for so many people turning up to share this with you. So on behalf of the Alcohol Health Alliance, many thanks indeed for a really most successful symposium and seminar. And we now put our hands up to clap.
Thanks everyone, and thanks for all the interesting questions and comments as well.
Yeah, thanks very much for inviting us.
Okay. Bye-bye, everyone.